Welcome, Dr. Kraft. How are you?
I'm great. Thank you so much for having me today.
Oh, I'm so glad that you could join me today and talk to my listeners, which is full of physician moms and professional moms and pretty much all in the medical and dental field. So this is great. So I'd love to dive in just first with a bit of your story. If you can tell us some of your background and what your story is.
Yeah, absolutely. It's a bit of a long one. I'll try to keep it short.
Okay.
I became a dentist very young, and I had my own practice for 14 years. I sold it. I started to burn out like most of us do. I wasn't taking very good care of myself as I was taking great care of all of my patients, just like a lot of doctors. And I can't even imagine also having I don't full disclosure, I don't have kids. I have furry animals, and I have so much respect for moms and people that do all of this, because the amount of energy that I have given to patients and then having to give that also to children
Mhm.
and take care of all of that is so impressive and so hard. I broke just by giving so much of my energy to my patients. I am a sensitive empath, which is hard in the dental profession. So I was giving all of my energy to my patients, all of my time, all of my thoughts, and not taking care of myself. And what that
Mhm.
led to was burnout,
Mhm.
physical burnout and mental burnout that I ignored. I got an autoimmune condition. I have a Hashimoto's thyroidosis now. I
Mhm.
didn't know what it was for a long time because I wasn't paying attention to me. It
Mhm.
took my body breaking. First, I stopped sleeping very well. Then I wasn't able to eat very well. And then I wasn't pooping. And then I
Mhm.
was crying and screaming on the way to work in the morning. And I was hurting all over. And I ignored all of that because I was doing so much good and helping so many people.
Mhm.
And then my hand started to hurt. And as a dentist who did a lot of surgery, I finally listened. And that was the physical burnout. The mental burnout was I started to get really frustrated with seeing all of these amazing patients and people that I was helping and fixing them, right? As doctors, we fix. As surgical people who do procedures, we fix. You can't fix people, they have to fix themselves. But I was seeing these cavities, seeing these diseases, and I was fixing them with things like crowns, bridges, implants, root canals. Not really root canals, I sent those away to all of these things. But everything I did, I understood that I was never actually getting to the root cause of what was causing the problem in the first place. And
Mhm.
everything I was doing to help people to fix their teeth and their mouth was just all going to come right back because I was never addressing why any of this was happening. So that coupled that frustration of not feeling like a good doctor anymore, coupled with the physical and mental burnout of giving too much of my energy away, broke me pretty intensely.
Mhm. Mhm.
And I had to stop and I had to sell my practice and I had to look at things a little bit differently. So I did that. Um, got some surgery, got some final understanding of healing what I needed for my body, and said, okay, I'm going to build a life that makes me feel good, that makes me feel like I don't need a vacation from every single day. So I
I'm laughing. Yes, it's true. Yeah.
and I wanted to be a better doctor. I wanted to know why all of these things were happening. Of curiosity, I like to know why. So I looked through, thought about going back to medical school, becoming an MD, but I'm like, man, so much of it is nutrition. Like I'm a dentist. I see what food does to people's mouths first. And there's not enough nutrition information in medical school. So I found the Andrew Weil Center. I did the 2 year fellowship in integrative medicine with them. As a dentist, there hasn't been that many. So I went and hung out with all you MDs and DOs and amazing nurse practitioners. And I was so far behind, I had to catch up and then go forward with that because they don't teach us the same things as you in dental school. I understand now why they say dentists aren't doctors after that training. I was like, oh, I get it. Okay, I get it. Um, so, really diving down into nutrition and lifestyle medicine, mind body medicine, Ayurvedic medicine, all of these things, I said, okay, now I understand. And all of the dental issues that I'm seeing come from lifestyle. So cavities and periodontal disease and oral dysbiosis and all of this is coming from what we're doing on a daily basis. So I got more interested in lifestyle medicine, got board certified in that, and I had all this knowledge, right? I knew how to tell people what to do finally. I knew the why, but I can tell people what to do until I'm blue in the face, as we know as doctors, and be like, I found out your diagnosis. I told you what to do. Like pat myself on the back. I did a good job. But if the patients don't actually do it, it doesn't do a damn bit of good. So I did a health coaching program because I wanted to help people first of all, learn how to meet people where they were, because as someone that just directed people what to do all the time, I wasn't so good at that. And then actually help them make the changes that would make their lives better, their health better, their teeth better, their whole oral systemic health better. And I learned even more about how what I was doing was affecting even more of the body. Most of us know about the heart mouth connection, but the connections to breast cancer, to adverse pregnancy outcomes, to Alzheimer's disease, to dementia, to rheumatic fever. What's the word?
Rheumatoid
Rheumatoid
arthritis.
arthritis. Thank you.
Yeah.
I'm like,
Yeah.
which
Yeah.
one is it? All of these things that I could make a massive difference in. So I said, okay, I want to build a practice where I feel good about how I'm helping people, not only oral systemically, but for myself. Because now, after learning that working 5-6 days a week doing intense surgical style dentistry breaks me, I can't do that anymore. And I had to mourn that because, boy, I love fixing teeth. It's so much fun. So going through the mourning process of saying, okay, that's not the most important part about how I can help people anymore. My words are. So I have built a more consultation style dental model, building a little bit of a new type specialty where I am sitting down with people doing full oral, systemic, integrative, even holistic, but not traditionally dental holistic, like just looking at whole health, everything, evaluations, doing oral salivary microbiome testing, which is fascinating. It gives me an objective measure of what's going on in people's mouths and the whole rest of their body that I can have direct influence on, and then creating entire wellness plans for people, that what they can do at home and what they can do with their doctors. I'm seeing patients now virtually in all over the country. With those patients, I have to focus more on what they can do at home, and if they would like, and if their dentist will listen, because not all dentists are this far in understanding how this science works, collaborate with them and their other medical providers. And I also am working with 2 different dentists in Tucson to bring this specialty style consultative practice into theirs to actually help the patients that are dealing with chronic diseases from an oral systemic health perspective, because I can make a difference in all of that. So that's what I'm doing. And all of this is back to, I feel good about this now. This is how I can help people and pay attention to myself and create balance for myself and teach yoga still, which I became trained in after, and work and do outdoor adventure guiding, because sitting in a dental office or a medical practice all the time without getting out into the 7th pillar of lifestyle medicine is nature. Makes me very sad. So finding that balance of practicing in a way that makes me feel happy, and like I'm actually helping the way I'm supposed to, and then balancing my own body's and mind's needs has been a hell of a journey with a lot of challenges, lots of ups and downs, lots of crying on the floor, being like, what am I doing? And then also a lot of elation, like, oh, this is working. You can't have the highs without the lows, but man, the lows suck so much.
Wow. Oh, thank you for sharing your story. So you followed the basic trajectory of, I want to be in dentistry, I want to fix people, I want to be hands-on, I want to help them. And you did that, but it broke you. And that was a low. But the curiosity is what pulled you out of that. And you pivoted and you started learning something new, and you found a whole new way to apply, not throw away what you know, but build on that. And so now you created this new life with what you already know and then what you just learned, and now you're helping people in a different way. And
Yeah.
you can see it on your face, you're thriving,
Most days.
basically.
Some days I'm
Yeah,
still
most
laying on
days.
the floor crying.
Well, I mean, there, with the ups, you have little dips and downs, but yeah, yeah.
Yeah, and then perimenopause is coming in. So like laying on the floor crying
Mhm.
sometimes is not really a life response. It's a damn, it's hormones response.
Something new to tackle.
Yeah.
So with a lot of women that I speak to are just beat down by, I'm going to shift a little bit to the the culture of medicine, or the culture of being a physician, and which is rather toxic these days. And so a lot of these women also chose what they wanted to do because they want to help people. They love the science behind it. They love working with their hands. They love working directly with patients and helping their lives be better. And also they help educating patients, right? Like, so teaching them, but that takes time and the culture doesn't allow that.
No.
So what is your opinion about helping others in this current culture, which I think has shifted dramatically over the past 10, 20 years, in so where you can still help your patients, but you can also help yourself, like what you're describing?
Yeah, absolutely. It involves some tough decisions. And it involves balancing. So you can use things in your current situation, which I didn't do very well, but now I'm figuring out better, to create space for yourself, to create moments, mindful moments, meditative moments, if you will, if that works for you, vernacular, throughout the day, to say, this is my time. And this is the time that works for me to reset, regroup, build that resilient time in between patients. Like, even for me, taking 3 deep breaths, walking before I walk through an exam room door. I'm sure that's a common one that a lot of people know about and use, breathing exercises. But within the culture, the tough decisions are, do you find a way to function within it and create those moments? And that's enough for you and that's enough for your body. Or do you say, this isn't for me? That's a hard decision to make. I couldn't make it, even though I knew I needed to, without my body breaking. Now going back, I really wish, if I could go back, I really wish I would have made this decision much sooner. So if you are at the point where you've tried all of the ways to function within your scaffolding, within your culture, within your hospital system or private practice system, whatever you're doing, and it's not working, take one thing at a time and say, I'm going to try this. I'm going to try to shift this and try one thing at a time. And if it doesn't work, give it up and try something else. Do you think that's helpful? What do you think? What works for you, Cindy?
So so my story is similar to yours. I did burn out with medicine multiple times actually. I would go through a period of burnout and then think that I fixed things, because I moved or I um, reduced my schedule. I went from 100% to 80%, which is a big deal because you get a day off a week. And I thought, okay, this is going to fix it. So I was trying. I was throwing things at the wall and see what they would stick, but it didn't quite work. So I think it's a matter of being persistent and or being consistent and just keep trying. It's what you're saying is that if you try something and it doesn't work, well, now okay, well that maybe I got something out of that, but I learned, okay, let's try something different. And it's just I think it's a matter of persistence and just trying new things, and you will find the things that help you, and you will find the techniques and we're bombarded with techniques, so this is what you should do. You should, like, breathing exercises is one example, but you know what, I don't like it when people tell me how to breathe, and so I tried it.
Ah,
I don't like it when they say, okay, now breathe in for 4 and now hold it, and I'm trying to follow their cues and it just gives me stress. So I'm like, I tried it, but I have my own way of doing it. So I use the numbers and I just count with myself and I don't listen to anybody else. And that works. So
that's
yeah.
wonderful.
So what I'm getting at in a long-winded way is that you just keep trying things that call to you. You keep trying things that sound interesting, and something will help. And those things build on each other. And I really like your point that it doesn't mean that you have to, gosh, sometimes you can, like you said, build the scaffolding and stay in your field. And sometimes the tough decision is to leave. And so that's another big one that only you can answer, or only, that woman can answer. And when is the point when you turn away? Well, that's, what, the answer's inside of you. And it's a matter of trying all these things and talking it out with someone. So I hope that answers
Absolutely.
your question. Yeah, it's trying.
It
Yeah.
does.
It's
Thank
being
you.
curious. Yeah.
It's interesting you talk. I want to talk a little bit about the breathing exercises. I'm sure you know this, but I've learned this the hard way working with
Ah,
people. If you're going through a lot of anxiety, having someone to tell you to hold your breath, is really a bad idea.
Hmm.
So the fact that you figured that out and what works for you on your own is commendable. And you took that initiative to say, no, that doesn't work for me. I'm going to try something else. I'm a
Right.
visual thinker. And you said something that really stuck with me and is actually one of the visions I have all of the time, which is throwing something at the wall and seeing what sticks.
Hmm.
So have you ever heard of the giant flying spaghetti monster?
No, go
Okay,
tell us.
so I'm sure there's more around this because my husband's explained it to me, but I forgot because I have too many things on my brain. So imagine you are a giant ball of flying spaghetti monster. You can have meatballs in there too. That's the other stuff. And whenever I think about some of the movies and some of the ways people test to see if pasta is ready, is they throw it to the wall and see if it sticks. So my goal is to be a really big spaghetti monster with like penne and rigatoni and like farfel and like all the different farfel. I don't know how to say the word, all the different shapes of spaghetti so that I can take and throw those at the wall and see what sticks. So if you don't know what to do, go and try to find a different shape of pasta and like build your repertoire of things and
Hmm.
then throw it at the wall. And if it falls off, go pick another shape.
Yeah, I love that. I'm going to be a big ball of pasta now.
Big ball of pasta, right?
Yeah,
Absolutely.
yeah. Throw things and see what sticks. Oh, that's perfect. Thank you for bringing that up. I'm going to steal that from you and your husband. So, but I wanted to spend a few minutes to really highlight your practice, which is integrative dentistry. And you did mention this a little earlier, but can you speak to how you are different from,
Yeah.
my dentist, I go to a traditional dentist and they clean my teeth, they say hi for 2 minutes and then they leave. So how are you different if people come to you?
Completely different. So
Yeah.
at this point, I am not doing traditional dentistry. I
Okay.
am working with traditional dentists and letting them do the traditional dentistry. What I'm doing is sitting down with people, and I don't know if anyone has done or has had a integrative health consultation where your physician dives down deep into all of the things that you're doing in your life, in your health, in your blood work, which I'm still not quite as good at reading as all of you guys, but I can get enough of it to be helpful.
Mhm.
Um, and really look at what is causing whatever problem that you are coming in for. Like people will come in for uncontrolled diabetes. I'm working with one patient right now that's had multiple pregnancy losses and wants to know like what oral contributors are making it so that she can't stay pregnant. Um, People having arthritis and IBD, IBS, Crohn's disease, the gut is one big tube. So I sit down with them, figure out what lifestyle things are contributing to their chronic condition that they're dealing with, which is why they're seeing me. This isn't, you're not coming in to see me for like a regular checkup. You're coming in to see me because all of the other things aren't working. Or they're going to the dentist and they're saying, every time I go, my gum disease never gets better. Every time I go, I have cavities every time and I'm doing everything right. I'm doing everything right and it's not working. Please help
Mhm.
me. What's wrong? Those are the patients that I'm working with, the chronic diseases and the ones where I'm trying everything, it's not working.
Mhm.
Um, I sit down with them, figure out other things that are actually working and not, because sometimes it's something simple. It frequently is that they just need to shift a bit. And then I also do oral salivary diagnostics. So when you go to the dentist now, you get your gums measured. They call it 323, 323, and that's the way that they're measuring gum disease. But by the time that you have those numbers that are getting higher and you're getting bleeding, it's already gone on far enough. It's kind of like um, all of the steps that lead up to getting cancer, but we can't find it until it's happened. So, as we know with cancer, early detection is everything. With gum disease, and losing your teeth from gum disease and chronic inflammation, having that affect your arteries, your heart, your brain, your breast, your prostate, your everything, your colon. Early detection is important. So I'm doing oral salivary diagnostics where I'm looking at the different bacteria species and amounts that are in the mouth that we know are aggressive, resistant to traditional dental treatments where you get your teeth scraped, cleaned, and x-rayed. Um, and doing different modalities, things like sometimes conjunction of treatment with traditional dentistry, scaling, root planing, cleaning, hygiene therapies, using dental ozone treatments, which kills bacteria that are resistant, that have become resistant to our mouthwashes. We're learning now, and our chlorhexidine mouthwashes, using alternatives to those, as well as sometimes systemic antibiotics to actually decrease the populations of these bacteria that are causing dysbiosis and causing the periodontal disease, the cavities, the dry mouth, the chronic yeast infections in the gut and mouth. They're connected. We can see that in your mouth before it gets real bad in your gut frequently.
Mm.
So doing the full, sorry, I'm long-winded, doing the full evaluation of lifestyle, habits, things, listening to you is the important thing, partnering with you and listening to my patients, and then doing this objective oral salivary testing, which is like blood work you'd get at the doctor. Saliva is to dentists what blood is to doctors when we're doing testing. And then getting the results, doing a follow-up, and really seeing personalized care, what you need for your specific bacteria species, for your specific habits, for your specific mouth. Sometimes using traditional dental methods, sometimes using alternative integrative, sometimes getting you back to your PCP, and looking at different vitamin deficiencies and doing what we can to support if you do need big dental treatment, surgeries, implants, root canals, extractions, supporting people's body's health and their ability to heal before, during, and after those procedures. It's a lot and it's wonderful.
I could really see, oh, thank you for explaining that, because I could really see how you could work with so many different specialties, not just
Yes.
PCPs, but specialists too, particularly GI docs, since you mentioned
Yes.
all one, two. And there's so much press on the microbiome in our gut, and which is fantastic that we're talking about that, but what about in the mouth? And I wonder, is there a world where integrative dentists are going to work with these different specialties? What do you think about that idea? And or
It's
maybe you're
already
already doing that. Yeah, tell me.
it's already starting to happen a bit.
Okay.
I have I feel like the first step that's going on is Dr. Bradley Bale and Dr. Doneen are cardiovascular, not cardiovascular surgeons, cardiologists, and they have come out with a preceptorship saying, hey, they're the ones that said periodontal disease is causing heart attacks and strokes, and here's why. And there are dentists and doctors that have done their preceptorships and learned with them. And there are some collaborations happening between doctors and primary care physicians. There's some medical dental groups that are trying to do this, but they're not doing it very well because there's still, dentistry is, you only get paid for your services when you're drilling or doing a surgery. And medicine is more, you get paid for your services of diagnosing, talking, and doing this. And there's a really hard disconnect between that, which is why I have to function outside of the insurance system, because it hasn't gotten to that point yet. Hopefully they will, but Lord only knows with what's happening right now. So there are people doing that. I think that I am extremely excited to start working with more specialists. That is my goal, my business model, my business plan, because it's not the people coming in for checkups that have the most benefit for me. It's the people that have something else going on. So like naturopaths, also people, GI physicians that come in, they say, oh, my gut, I'm doing all of the things right. Once again, I'm doing all of the things right that medicine has taught me to help IBD, IBS, Crohn's disease. I'm doing all these things, but it's still coming back. It's not as good as it should be. Well, there's probably an oral component. I mean, we swallow 1 to 2 liters of saliva a day, and there's billions of bacteria in there. And the oral and gut connection, we used to think, oh, the stomach acid kept them apart, right? It keeps them separate. The oral bacteria doesn't migrate to the gut. Oh, what about proton pump inhibitors and antacids that these people have been taking because they've been having GI tract problems? We are, I know, preach, right? We are. I don't know if you guys can see that. She had her hands up, like, yeah, absolutely. So, we are causing all of these problems as we're trying to help. And the more we know, the better we can do. And that's kind of what I have to tell myself too. When I think about all the patients that I treated general dentistry, doing the best I could with what I did. And I think back now and I'm like, oh my God, I missed so much. I want to do better for all of them. I want them all to find me again so that I can do better for all of them, because I know more now. So it's that forgiving yourself for who you were and doing the best you can and continuing to push the envelope and work with specialists and work with oral systemic understanding providers to make whole bodies better. Does that answer your question?
Yes, it does. Absolutely. So I'm thinking, what if someone listening today would be like, you know what, I have this patient and I would love for you to, we've done everything and they're doing all the things. If they wanted to send someone to you, how would they do that?
Absolutely. So I have the site. I have a website that is accessible to everybody. My websites are, sorry.
Yeah.
That is called handcraftedlife.com. My last
Mhm.
name's Kraft, like the cheese and macaroni. So it's spelled with a K, like the
Okay.
macaroni and cheese.
Got it.
And I'm doing holistic oral systemic consultations and salivary testing nationally. I am doing that from, one disclaimer, I am doing that from a health coaching model because as a dentist licensed in Arizona, I'm only allowed to diagnose, prescribe in Arizona. We all know this as doctors. So I will happily collaborate with anybody and do the entire oral systemic evaluation, salivary testing, and follow up wellness plan, and work with whatever specialist wants to send me patients to help figure out what else is going on orally. And there's
Mhm.
always a component. There's
Right.
almost always something out of line. It's like 80 to 90% of the people walking around have some form of oral dysbiosis where their bacteria are not helping them like they should be.
Mhm. Wow. Yeah, that sounds like a great opportunity, and you are another resource for so many docs out there that have patients that are just resistant to what we know already. So,
Yeah, not everything
yeah,
works for everybody. Everyone needs to find,
no.
the patients need to
Mhm.
find their own path. Some
Mhm.
people resonate with some of the things I say and what you say, and some of them won't, and we'll go find
Right.
something else. And the key is to just get them to hear the thing, the one thing that allows them to under,
Hmm.
to make the change for themselves.
Right. And thinking to go on a lighthearted note, thinking back in my career as an anesthesiologist, I've seen a lot of mouths. And
Oh man, I bet you have.
but no one prepares people prepare when they go to see you or any dentist. They brush their teeth and they floss. They're like, okay, here I am, but not so much for anesthesia. So yeah, boy, thinking back, I wish I could have referred a lot of people to, you need someone to help with this because you can see the gum disease and the bleeding and how friable the tissues are. And yeah, anyway,
Yeah, yeah. No,
but
you think they don't prepare for they don't prepare for the
oh, they
dentist.
don't either. Oh, I'm
No,
assuming that's my assumption. I apologize.
sometimes they do, and we're very please. Thank you for all of you that do. Please, I appreciate you so much. For the ones that don't, please brush your teeth and floss them before you go to the
Before you
dentist.
go to the dentist.
That helps, but there's other things, right? And then
Mhm,
like
mhm.
I just saw an interesting, I know we're out of time almost, webinar on um, oral um, oral herpes, herpes simplex viruses,
Mhm.
and significantly increasing the chances when we don't treat them aggressively like we're supposed to be of Alzheimer's dementia later in life.
Oh. Oh.
And so that and aphthous ulcers, and a lot of dentists don't really know what to do with that. So that's
Yeah.
newer research and science coming out, and we're going to be making a massive difference in brain health with what we
Mhm.
are doing. Speaking of working with specialists
Yeah.
in
Yeah.
prevention.
Yeah. You're connected to every system of the body. That's great. And speaking of aphthous ulcers, um, we had a problem with that in our family and would ask our dentist, this is years ago, and they didn't know, like just like you're saying, it's not common knowledge. Um, so that's
What did you
something
do?
we asked. Oh, well, it was lysine, taking the
Yes.
supplement L-lysine worked like a charm. We tried everything else. We tried different toothpaste. We tried different mouthwashes, and lysine was it. It was magic. And then there were no issues.
That is
Yeah,
amazing.
yeah,
See, that's a tip for
yeah.
everyone. A lot. I mean, even then,
Amazing.
like how many of you listening now are like, oh,
Yeah, just because they're so incredibly painful and they get worse with stress. And I had them in college and med school and it was just miserable. And
yeah, I did too. All that stress. Oh my gosh.
yeah,
I was in dental
yeah.
school. Like, oh, I've got cancer.
It,
Even
yeah,
though
if
it's not.
only we'd known. If only.
Only we know.
If only we'd known. So, what are some, just to end on a light note, what are some burning questions that people ask you? Like mine was about aphthous ulcers, and thankfully I have my answer. But what are some other just common things, for our audience, maybe who have kids running around and, oh God, what do I
Yeah.
do with my kid? They're having this problem. What are some common questions for you?
Absolutely. So, what is that? I can tell people all about their oral health and everything. You know what? The one question that always come up with me, yeah, but what toothpaste do I use?
Yeah,
Right? Because that's
yeah.
going to fix everything.
Uh-huh.
It's not. There's multi things, but once again, personalized medicine. Different people need different things for different issues. Speaking of kids, I met an amazing dentist recently who has is a pediatric dentist. And he
Mhm.
told me the story. He always told people, like, oh, just use whatever toothpaste you want for your kids. It's fine. Just, don't let them swallow it if it's got fluoride. And then
Mhm.
he finally had kids and he's like, oh, what toothpaste do I want to use for my kids? And that
Mhm.
answer wasn't good enough anymore. So he created an entire company using all of the
Oh,
latest science on the best toothpaste and products used for kids. It's called Supermouth, like a superhero, but it's Supermouth. And they
okay.
do have adult products, and they are really effective at killing different types of not the pathogenic bacteria, but not all of the bacteria. It
Got
can
it.
be fluoride free. They're using hydroxyapatite, nanohydroxyapatite, vitamin K2.
Huh.
Vitamin D, vitamin K2. They're using all of what science has gotten us to, which is the best option for children, for people. And then the other question, fluoride, good, bad, mostly bad, best we
Hmm.
had at the time, kind of like silver fillings were the best we had at the time. So we did
Hmm.
those. Fluoride was the best prevention of cavities that we thought we had at the time, not as preventive as we thought. Um, we have better science now. Now we can use things like nanohydroxyapatite and xylitol mixed together, which actually remineralizes teeth better. But the real question is, why are your teeth demineralizing in the first place? Remember, why? It's not the toothpaste. It's all of the lifestyle habits that you're doing on a
Mhm.
regular basis. Why is your body reversing the pull of building your teeth up with minerals, which is what's supposed to happen all the time, and instead pulling minerals out of your teeth? And if it's pulling it out of your teeth, guess where else it's pulling minerals out of? Your
Yeah.
bones.
Mm.
So if you are having those cavities all the time, what else are you missing in your diet, in your habits? That is
Mm.
causing your body to reverse that building into destruction to pull those minerals out. It's not just the bacteria in our mouth pooping out acid and eating away our teeth. That's part of it. There's so much more involved. So we can find out more, and the dental profession will do better. It's lagging, but it will do better with figuring out why all of this is going on. There's so much science and research happening now to be better about this, because just like in medicine, we thought it worked this way
Yeah.
and we were wrong. And now we're learning more and doing better. That happens on a regular basis. And so we're doing better too.
So the ingredients that you mentioned that help better than fluoride, now that we know different, are in that one brand you're mentioning, Supermouth. Is that
Supermouth
what
is
you
really great for kids. They do have
that
an
one for
adult product.
kids?
I
Okay,
find
yeah.
I find their adult products a little bit too sweet, personally, for my own personal palate. I don't like sweet things as much. I know it's perfect dentist, right? But but there's Boca, there's Spry, there's several different options if you want to be fluoride free. And I will give you
Okay.
one caveat with fluoride: the people that need to avoid fluoride more are those that have an autoimmune condition.
Okay.
Um, there is lots of science coming out that it's not good, but if you don't have access to the others, it's better than nothing for most.
Right.
But swallowing it in our water supply is not so good. Topical application is better, but we have better products that are coming out. So get curious and ask questions.
Exactly. That's the word, curious. And I have one question. So when we look back, there's a conference in Arizona, the Andrew Weil Center for Integrative Medicine, that just happened in January. And in the conference, and I'm trying to remember exactly where, we learned about our ancestors and their teeth, and
Mm-hmm.
how, oh, by the way, they used to be straight. They didn't have braces. And I'm thinking right now, as I sit here, oh, by the way, were cavities as prevalent then when you speak to about lifestyle and we're eating sugar and we're having diet soda, and they didn't have that back then. So I'm really curious, what were the teeth like from a cavity standpoint for ancestors, if you know that one?
So it had to do more with partially what they were eating and how they were eating it. And that's actually an airway question, which is another thing that is a major focus, especially of working with pediatric or kids. Our airways are shrinking, and our ability to have space for our teeth is shrinking, and our foods that we eat, we're no longer, our airways are shrinking because we don't have to chew our food as much anymore. The function of the teeth and the muscles working together to build, maintain bone and build the whole shape of our face as we are children has completely changed throughout massive amounts of time of human history. And their teeth were better because they were eating more fruits and vegetables. It was better because in eating those fruits, vegetables, grains, and meats, they had to chew them more. It wasn't ultra processed food or highly processed
Hmm.
food. And when you chew more, the food stays in your mouth for longer, right? But it wasn't full of sugar. And it all of the phytonutrients that they were getting was allowing their body to have that better push pull of mineralizing, demineralizing. So they were more replete with the minerals and nutrients they needed in general, for 40 years until they died of old age at 40.
True.
But
Yeah.
it was it was a little bit
Good
different.
point. Yeah.
But they could breathe. They had their mouths closed at night when they were sleeping. They had their mouth closed and they breathe through their nose more primarily, which keeps your mouth more moist, which allows a healthier microbiome to function. If you have a dry mouth, like all bets are off. We need to do everything we can to support your oral health because you don't have the saliva to feed the bacteria. One final note: it's
Hmm.
not the food that you eat that feeds your bacteria, your healthy bacteria in your mouth. There's good guys and bad guys. It's not the food that you eat that feeds the good guys. It's your saliva that feeds the good guys. So if you don't
There
have
you
enough
go.
saliva and you're not eating enough nitric oxide producing foods to create salivary flow, you don't have enough good guys. So once again,
Okay.
lifestyle and diet.
Yep. And if you have a dry mouth, inquire about it. Okay. I know we're
Yes.
about out of time. You did mention your website again, please, for people to contact
Hand,
you.
yeah, handcraftedlife.com. Crafted with a
Perfect.
K.
Yes, I will put that in the show notes. So I so appreciate you coming here today and talking with me. This has been a delight. Thank you.
Thank you so much for asking me, Cindy. I feel blessed to be here.
Oh, thank you.